I was looking at Google, and it says, what is the main cause of someone's denture, tooth, or immediate load teeth breaking? And one of the doctors there said, drinking milk or eating ice cream.
To be honest, I understand those
The patient,
patients. The patient that they want to eat after to the next day to this kind of surgery, because they come here, they have a lot of problems, infections, pain. So for a long time, probably they can't chew in really good.
I think confidence, right? I think with our experience here, the many patients that we've seen that have to go without teeth, it really hurts their confidence. It helps them smile again, because sometimes people come in with really bad teeth and the temporaries look really good and they're happy about that, right?
But what if I don't use my dentures? What happens if I don't use my regular dentures because I didn't want immediate loads, and I just get them and I put them in a drawer and I start chewing with my gums? What can happen? Hello, welcome back to Supreme Dental Podcast Studio. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. And today we have Dr. Elias.
Hello,
and we
Frank.
have Dr. Alonzo. Welcome back.
Hello, Frank. How are you?
Not too bad, not too bad.
Not bad.
Today I want to talk about a little topic that we've had numerous questions from numerous patients, and it talks about the immediate loads. We're going to walk our patients through what exactly is an immediate load, when can it be done, why is it done, and all the positives about it, but also the negatives about it. All right, because we're completely transparent.
Right.
So I don't know who's going to answer first. What's exactly an immediate load?
Well, an immediate load is a part of an all-on-4 or an all-on-X treatment. It's basically what it is after the surgery, after we remove the teeth, or if there's no teeth after we place the implants. That's when we actually load the implants with some temporary teeth, right? That's basically what it is. It's an immediate load onto the implants where we basically put teeth onto the implants right away.
Okay, so somebody comes in, pulls their teeth, gets implants, and it's able to walk with something already loaded on their implants.
That's correct.
Not the other temporary. What other temporaries do we have?
I think the other thing is dentures.
The conventional
The
dentures.
conventional dentures, yeah. But we don't recommend those. When we do all-on-4 or an all-on-X surgery, what we want to do is we're always thinking about the final prosthesis. Even before we actually do the surgery, everything that we do, the surgical part, everything is prosthetically driven, right? Because we at the end of the day, people don't come in for implants. They come in for teeth, right? And we want the teeth to look and to be functional as well, but to look good as well. So that's what we want for sure.
Okay, that makes perfect sense. Now, tell me a little bit about some of the problems, perhaps. We're going to start with the negatives, perhaps, of having an immediate load. What do you think are some of the problems that we see with immediate loads?
With immediate loads, well, usually, I think the most common problem is when the teeth fall out. I think that's the most common. Why? Because this kind of immediate loads, I highly recommend you more for the main purpose is for aesthetic reasons. It's not completely for chewing, and for sure nothing really hard. So when the patient starts to chewing something hard, the teeth can break or they can fall out. So for sure, in 6 months when they come back, we give something much more strong and much better, but not yet. This is a process. They have to wait 6 months, and we're gonna leave with something temporary. This immediate load that is acrylic, and the acrylic is good and it's strong, but it's not really strong to eat something really hard. That's the reason the teeth can break or the teeth come out. So I think that's the most common problem. So sometimes the patient have to come back again. We have to remove again this kind of denture, send to the lab, and they place a new teeth. But it's a very common problem, I think.
Welcome to Children's Dental Facts. Did you know you can fill up 2 swimming pools with your saliva over a course of your lifetime? You heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
So one of the things is to let patients know is that when you come in and you get immediate loads, they have nothing to do with your final work.
That is correct.
So we just do an immediate load for you to have something in your mouth for those 6 months. Obviously, you guys will explain a little bit more in depth of why those things perhaps are needed. Not everybody is capable to do immediate loads, but for those who are, the problem that we see, and it's a known issue, is that patients, because they no longer feel the strength of their bite, because how they have artificial roots, they bite down very hard, especially with things sometimes that they shouldn't eat.
Right.
And then a tooth flies out, and now they think, well, I paid so and so much for these, for that tooth to fall out. Now I have to go back. Well, it's just temporarily,
Exactly.
so they don't lose perhaps their dimension. Tell me a little bit more about that. Like, for example, when you give somebody immediate loads, we know that you give somebody back an immediate smile, and we know that it's something to do with aesthetics.
Right.
But what else is a positive side of the immediate loads?
I think confidence, right? I think with our experience here, the many patients that we've seen that have to go without teeth, it really hurts their confidence. It helps them smile again, because sometimes people come in with really bad teeth and the temporaries look really good and they're happy about that, right? Another thing, as you mentioned, is to maintain that vertical dimension, the difference between the lower jaw and the upper jaw. If we divide the face into thirds, our mouth completes the lower third, right? When we lose that dimension, when we don't have any teeth, our jaw tends to go upwards, and that's when you have like the witch look, how old people tend to look, how their chin tucks up, because they've lost that. But once we restore them with teeth, their face becomes longer and it becomes more natural as well. That's one of the advantages. Another of the advantages is that muscle memory, right? Because the teeth themselves, they're going to serve as a stop for the muscles. When we don't have any teeth, our muscles and our TMJ just goes everywhere, right? So that's why it's very important for us to leave a really good occlusion, good bite, so the muscles get used to for that transition line, as you were explaining to us earlier, when they come back for the real teeth, that it feels more natural.
So I have a question for both of you, okay? So let's say I come in, I extract all my teeth, and I say, you know what, I don't really want immediate loads. I don't really care about that. I'll just have dentures, okay? I have dentures. Obviously, I should know that with dentures comes that my gum's going to shrink. Those dentures are going to fit bigger. I'm going to have to use Fixodent's going to be my best friend for months.
Right.
And food's going to get underneath. And, I'm going to have to work with those things because they're just tempers. They're throwaways, right?
Right.
But tell me about, our patients, like I said, let's say I'm coming in and I'm going to go ahead and get this done. And then I said, no, well, I want dentures. I don't want to pay the extra. That's it, right? But then I don't wear them. For any reason, I'm like, you know what? Nowadays is the big face mask. Everybody wears face masks. So face mask is okay. Before, we're talking about 5 years ago, you wear a face mask, people's like, what's going on,
Right.
Like, and now everybody can wear a face mask and nobody's going to question you. It's okay. So now if you want to get a procedure done, it's the time to do it. But what if I don't use my dentures? What happens if I don't use my regular dentures because I didn't want immediate loads, and I just get them and I put them in a drawer and I start chewing with my gums? What can happen? What are the things that can happen?
Well, basically, is like Dr. Laya say, the vertical dimension, we can lose that space between the maxillar and the jaw. So we are losing that space. So that's very important. That's the reason it's very important. Use at least this kind of temporary dentures, the removable ones, to try to avoid that problems. Why? Because when the patient come back for the final work, always it's more difficult try to make match completely
Exactly.
the bite, and the
Exactly.
muscles have to learn again, eat, chewing. That's the reason, at least, always will be a possibility, the temporary, the removable one, at least, because in more for aesthetic reasons, like said. But yeah, at least I highly recommend you use this kind of denture.
I remember one of the cases, because back in the day, we're talking about maybe a year and a half ago, we used to not work with immediate loads, and we used to have patients come back, and when they came back, you can tell when they didn't wear their dentures, but then you gave them their final work, and they felt like they had too much in their mouth. Well, because now they're used to closing, instead of closing like this, now they're used to closing like this. So now you put something there, and it feels like it's too big. And I always tell them it's kind of like being barefoot. I don't know if you guys have been in the beach. If you guys go to the beach, I happened to go not too long ago. I went to the beach, and I was there for about a week. I know you just came back from the beach, and I guess kind of jealous, but and I wore just sandals and barefoot. And then on my way back, I put on some shoes. And it felt terrible. Like I felt like my foot was swollen or something, because I could feel each and every crease on that shoe. And I believe it's the same thing when you don't wear your dentures. When you put something there, you feel like something is not right. And that's what we say is very important for our patients, that 50% of the work is done here and the other 50% is back at home, especially when they would wear those dentures. But now immediate loads take care of that.
Right.
So let me recap a little bit. So we talked about immediate loads. So when they walk out of here with something, it's not their final work. It might look very nice, but it's not going to be as durable.
Right.
It's so the patients do not lose their dimension, and it's so the patients have something aesthetically, help them with their self-esteem. Most of the time when patients walk out, they're already improved their smile 150%. Actually, we had a video. We'll put some immediate loads from Dr. Elias. George will take care of that. And of that patient that when he was talking, one of his tooth was moving.
Right.
And then we gave him, and he said, why do you want to record a video? I remember, and I'll never forget this.
Yeah.
And I told him, I dug deep, and I said, so we can show the world that there is hope. Because he had most of his teeth, but they were already out there. So when he has the immediate loads, he then decides, yes, I want to record this video. Because then he says, now he's smiling. When he speaks, it sounds different because there was nothing loose in his mouth.
Right.
So he's already walking out, and everything is, oh yeah, and he says, yeah, he has the little,
Yeah.
and
A little
then
gesture. Yeah.
He says, he hadn't had teeth like that since he was young, so, and he's already waiting for his final work is gonna be way better, because I believe he went with the Zerpix.
That's correct.
So it's a huge game changer. But then we have patients that get the immediate loads, and then they want to eat everything normal, because they're like, well, this is the All-on-4, but it's just provisional to the final work.
Right.
Yeah.
So what do you guys say to those patients? Like, there's a camera right there. What do you guys say to those patients? Like, we're on the process to get this done. It's like having a cast on your leg.
Yeah.
Use your crutches. Use them right. People tend to, I'm not able to eat this, and now I have some teeth that don't hurt. Now I'm going to go and eat that corn on a cob. I'm going to go eat those, whatever they're eating, and that's when it goes bad. So what do you suggest patients eating while they're on the immediate loads? What do you tell those patients?
I think the threshold, what I learned in Spain, was basically what you can break with the fork without applying too much pressure. That's how much you're going to be able to chew, right? And what happens is that the implants are still healing, right? They're inside the bone. We got really good torque. They're in there tight, but the bone around the implant is still gonna change to adapt to that implant, right? We want some pressure to be applied to that bone because the way the bone works is the same as a muscle. If you tend to apply a little pressure to it, it's gonna maintain its volume, right? But if you force it, just like if you go to the gym and you try to lift weights that are beyond what you could do, you're going to hurt yourself. And the bone is the same way. Now, with the immediate loads, because they're in a temporary material, when they break, I would say 95% of the time is because you're going beyond the threshold of what the implants can actually receive. So we would rather have that break, and knowing that our implants are not going to be in any kind of trouble, and that'll let you know that, hey, you're probably eating something that you're not supposed to be eating, right? So that's what I would tell them for sure.
What do you say about that?
Well, and I think, to be honest, I understand those patients that they want to eat after to the next day to this kind of surgery, because they come here, they have a lot of problems, infections, pain. So for a long time, probably they can't chew in really good. So right. I understand that point. So they want to eat and smile the next day. But to be honest, we don't recommend. Why? For those reasons. We have to avoid make a lot of pressure in those implants, because they are not completely ready to heal. So, and for example, in my patients, always I try to explain, this is the few days is after to do this procedure, All-on-4, All-on-6, is soft diet, even sometimes it's a liquid diet. Right. The next week they can start with a soft diet. But yeah, for sure, this is a process. They have to be patient, and so they have to go slow. And for sure, the reason that we place those implants is because by the time they're gonna start to eat and chewing everything.
Right.
And having confidence in your smile is what we see. We see somebody come in. And I always tell them, go ahead and show us, because a lot of times they don't even want to show us.
Cover their smile.
They cover their smile, but they don't even want to show us. They're just like, oh my gosh, they know that either they have not taken care of, or whatever the situation would be, medications or whatever it was, that really destroy their teeth. But it also, to me, helps a lot people that have some sort of mental health, because giving them their confidence back, making them feel like they could smile again. The smile is the beauty of the face.
Right.
You can now smile. You walk out of here, it's not the permanent work. And perhaps you're a little bit sore because you got the implants done. Not everybody gets extractions, but the ones that do, maybe you're a little bit sore. But now you can smile. And that is a world of a difference. We've had one of your patients that will put a clip, and we've done it before, when she said we changed her life. And most likely we saved her life.
That's correct.
And that was something with immediate loads also, that she came in and she wasn't expecting that.
Yeah.
And she was very young, or she is very young.
Really young, yes.
And I'm very excited to see both of those videos, because we have both of these videos on Instagram already. But I want to see when they come back. I want to see how their life has changed. If they walk in, how they walked in the first time, or if they walk in with the swagger. Because if they're excited about what they walked out already, wait till the final work, when now they have something that perhaps is a lot nicer already than what they got, but now it's more durable. Right. So that gets me extremely excited. One of the things also that I want to talk about is, let's say that I got the immediate load. And let's say I was eating something that I was not supposed to eat, even though I was looking at Google, and it says, what is the main cause of someone's denture, tooth, or immediate load teeth breaking? And one of the doctors there said, drinking milk or eating ice cream. Well, that's one of the main reasons that we always get is, I was drinking water and my tooth fell out.
Yeah.
Or I was eating something soft and it came out. They will never tell us, I was eating a corn on a cob, or I was destroying a steak, and it's okay.
Right.
But now my tooth is out. It fell out. I'm in Florida. I have a wedding in Saturday, and it's Thursday. What do I do? How can I fix it?
They have to come back. That's the thing. That's the thing. They have to come back. And that's the reason always we talk with the patients that is we don't recommend eat nothing hard.
Too hard.
Why? Because we know the patient come
from far away.
Far away, exactly. So it's a lot of they have to take a flight. Is time, is money. We know that, so we want to avoid those situations. Why? Because the only way to go if one to come out is they have to come here again. They have to come back and remove the denture, use the screw, remove the denture, send to the lab, and they can place. And probably it's just one day or a couple of days, but the patient come for far away.
You're talking about the immediate loads?
The immediate loads.
So I said this before, guys. Obviously, that's what you would tell a patient. But we're going to do the backstage. We want now, I'm talking to you as a friend. Hey, man, my tooth fell out.
Right.
And I got a wedding this Saturday. What do I do?
Super glue.
Super glue it.
Yeah. I mean,
that's the backstage stuff. It's not the correct thing to do, but these are temporaries.
Right. I mean, it's a warning sign, you know, and it's telling you, hey, you got to chill out with what you're biting on. It's temporaries. If you put the right amount of super glue and you can pop it right back in, because the tooth doesn't break itself, right? It just detaches. So you can attach it back in with super glue and have no problem at all.
It detaches from the acrylic.
That is correct.
But not from your implants or anything like that.
Yeah, the implants are intact. That is correct.
So you put a little drop of super glue and you make sure it's in the right direction and you put it on.
And that's it.
That's some VIP stuff right there, guys.
Yep.
So obviously
this is like the last option,
last
right?
resort.
Yeah,
Right.
the last option.
Yeah, we don't do that when you come in.
Oh, no.
We send it to the lab. But if you have to get it done and you don't want to come back, or you're like a month away from coming in, you know, like I said, it's just an immediate load. When it's your permanent work, then it's a whole different ballpark. Then you got to go to a dentist, or you got to come to us. All the warranty through us, you know, we make sure we take care of that. But yeah.
But it rarely happens with the final work. Yeah. The only thing I've had, it was the patient had a car accident.
I remember that one.
Right. So it's trauma, you know. It's not like they were just eating or their everyday life. You know, it's pretty much trauma. But other than that, we haven't had any issues with that.
So all in all, somebody's coming in. They're going to get All-on-4, All-on-6. You say immediate load yes or immediate load no?
Immediate load always.
Always.
Yeah. It's better for the implant. It's better for the gums. It's better for the patient. The implants heal faster.
Even it's better for us.
Yeah. Yeah.
To be honest, yeah.
Yeah, when you guys are doing the final work, then the patient doesn't feel like it doesn't fit.
That is correct.
So it's a lot easier in our process also.
Mm-hmm.
So it's a win-win for everybody.
Yeah. We don't have to numb up. We don't have to cut again. It's already there.
Oh, that's true. You don't have to cut and tell them to come back the next day because their implants are already active.
Exactly.
That is correct. Yeah.
Oh, that's true. That's true. So it's a lot. Perhaps you skip a day.
Yeah. More than a day, probably.
And no more needles.
No more needles. Yeah. We do less tests because we already have a prototype in hand, right? So we have a vertical dimension and we can skip that test as well because we already have it.
Mm-hmm.
And with the right technology that we have right here at Supreme, with the scanners, the pictures, the labs that we work with, we make it better.
Well, I think that covers it all. So we talked about it looks great, but it's something temporarily. We talked about the function that it does for your mouth and the benefits, but also the negativity of it, which a tooth perhaps might fall off. They don't normally break. They just fall off.
Yeah.
Mm-hmm.
But that is depending on what you bit and what type of strength you're putting in. Very important to go with liquid diets or perhaps just salads, sandwiches.
Exactly.
I didn't know that one, that if you can cut it with a fork,
Mm-hmm.
but you can cut it like this, not like this, right?
Right.
You
Yeah.
can cut pretty much anything.
Very minimal
So
pressure.
just like minimal pressure.
Yeah, don't try to cheat through it.
Yeah,
Yeah.
you cheat the system.
Yeah.
All right. So that's perfect. That's perfect. No, thank you so much, guys. Thank you so much for coming.
Thank you for having us.
Frank.
Yeah.
This is one of the most frequently asked questions that we talk with from different patients and different agencies that we work with. They've been saying, hey, do one on immediate loads so patients can understand it's not their final work.
Right.
And if a tooth falls off, don't get scared. That has nothing to do with your final work.
That is correct.
Well, thank you so much for coming, guys. I know you guys are super busy. I know you're probably still jet lagged because you just came back from Thailand.
Yes, that's correct.
I can see that you're kind of just like, I'm out of here.
Yeah.
So, but thank you so much. And thank you guys back at home. Like I said, don't forget to like and subscribe. We got a phone number. We have an email address. Send us any questions you guys have, any podcasts in the future you would like for us to make. Remember, this podcast was meant for you, the patients. And we'll see you guys soon at Supreme Dental, where smiling starts here.
Thank you, guys.